Hi, I'm Jane from Pre-Med, and there's been so many questions. We broke it down into 3 parts. This is part 2. So we have another question for Dr. Telang. How many on your medical team, and what board are they registered to?
We have a team of 6 people who work with me in the OR. So we have an anesthesiologist who also looks after the pain management. We have my own assistants who have been with me for more than 6 years, and all of us are registered with the local medical board. We are certified to practice cosmetic surgery in Mumbai and in India, and we get renewal of the accreditation every year. Because it's a small team, I think somebody also asked about how we are able to do what we do.
Why are your prices so low?
Yeah, we can always charge you more if you want. But we managed to keep the prices low because one, the cost of living is a little cheaper in Mumbai, and second, we have a very small team. Because it's our own cosmetic surgery center, we don't have any additional surcharges or any taxes which go on increasing your overall bill. So we are able to do it at a lower cost.
Plus, international patients get a good exchange rate on their money, the dollar against the strength.
Yeah, and it's my dream to make FFS affordable to everyone. If you can have FFS done in an affordable cost, what's the harm?
The most common revision needed. Reason why? How many have been needed? Do you charge for your revisions?
Okay, let me be honest with that one. The only revision I've had was in a patient who had a chin implant, and the chin implant somehow got little malpositioned, so we had to reposition it. By and large, we have been lucky in terms of not having to do any major revisions. But if any of my patients needs any revision, we always do it free of cost.
Can anybody argue with this? Gummy bears over round. Just explain what a gummy bear is first.
There is a lot of interest, not only in India but world over in the gummy bear implants, and they are very interesting because they are shaped like a teardrop. The indication for a gummy bear implant is somebody who is very thin, somebody who has where the thickness of the upper pole or the soft tissue in the chest area is very thin. If you want to have breasts which are natural looking and more shapely, then you can think of a gummy bear. If you want a deeper cleavage and if you want just to have bigger breasts, you can go for round implants. Now, whether to place them under the muscle or on top of the muscle, again there are 2 main things which determine this. One, thickness of the upper pole tissue. If somebody is very lean, it's a better idea to put it under the muscle so that the implant is covered by the muscle. And if you want to have implants which don't have a capsular contracture in the longer run, I think submuscular makes more sense.
How long does somebody need to be on hormones before that? And what if they don't have any breasts to start with?
Most of the patients who come to me don't have any breasts to start with. Being on hormones is a very individualized treatment. If somebody is on hormones, you can have a better amount of breast tissue. So maybe you can have a bigger implant, bigger pocket is possible. But even if you're not had any hormonal treatment before, we can still give a better result. It's not a problem.
And that's where the gummy bear comes into it. If there's no breast there before,
we can always.
I think were they not introduced before for prosthesis? People that had mastectomies, the shaped one was to give them a natural looking breast.
Yeah, more natural looking breast. Yeah.
So people like with the trans community, they seem to have latched onto it, and you too, because it seems to be a better outcome for people with less breast, as they were developed for mastectomy.
Yes, it's all a matter of the aesthetics. You want something which is more feminine, more natural shaped, gummy bear it is for you.
Part of the breast implants is rotation and encapsulation. What are they and how do you try to overcome them?
Rotation of round implants doesn't happen. Rotation applies mainly to the gummy bears, where the upper pole has to be properly placed in the pocket. If it migrates and if it moves to one side, then the upper pole can become visible. Capsular contracture, I personally believe it depends on how you perform the surgery. If the pocket in which you place the implant is adequately sized, you have good hemostasis and you have given good antibiotic wash, capsular contracture is less than 1% in my practice.
Lower jaw and chin augmentation and a facelift together. So doing the two surgeries together. So we're doing the chin, the jaw shave, and a facelift at the same time. Sometimes I've seen you do lipo and a buccal fat removal all in the same. What type of facelift is it that you're doing there? And also, what's the difference between this SMAS and M.A.C.S?
See, I always do lower jaw as one unit. So the jaw shave, the chin reduction and the facelift, they are done together. I personally believe if you remove too much of bone on the jaw and you don't do a facelift or a neck lift, you're going to have too much of saggy tissue around the jaw. It's going to damage your jawline. Your jawline is not going to look nice and taut. So we always do a neck lift or a facelift together with the bone shave. The second question was the difference between a SMAS and a M.A.C.S lift.
Yeah, let's just go back a little minute. Let's go back a little minute. On a very younger patient, you're not going to do a facelift. That's an obvious. So on a younger patient, you're not going to do a facelift. That's for sure. But what about the buccal fat and that? Isn't it to show off this new jawline that you've created?
Buccal fat pad is basically for somebody who has chubby cheeks. So when you want the high cheekbones to stand out, it makes more sense to remove the buccal fat pad because then it slims the cheeks here and that gives more prominence to the cheekbones, makes it look better.
Having all this shaven off, this bone work done, and it being covered by buccal fat, then it's not going to be able to be seen, isn't it? It seems like a waste of surgery, really, if you can't see it.
But it's in a different plane. Buccal fat pad is for the cheek, and your facelift and neck lift is for the jawline. So it's a little different areas, but you can do both.
And as we get older, is this not the fat that sags down here into the jowl area?
I think you have one question on difference between the SMAS lift and the M.A.C.S lift.
Well, go on then. Explain the difference between a SMAS and a M.A.C.S.
A M.A.C.S lift is basically for a younger group of patients. So somebody who's between 40 and 55, you can just do plication of the superficial musculoneurotic system. So in a M.A.C.S lift, there is less dissection, the recovery is that much faster. And there are stitches which are used to tighten different areas of the face which are fixed to the fascia in the temporal bone. In a SMAS lift, it's a deeper dissection. We go under the SMAS, free the SMAS from the underlying muscles and lift up the deep muscular planes in the face. So risk-wise, SMAS has more risk of a nerve damage, more recovery time as a M.A.C.S lift, but for an older age group, I think it would be more M.A.C.S lift or more SMAS lift than the M.A.C.S lift. See, let me explain the difference between a M.A.C.S lift and a SMAS lift. So, M.A.C.S lift is basically for a younger age group, somebody who's from maybe 40 to 55, where the dissection is lesser. There are just some sutures which are used to tighten different areas of the face. So, your recovery is faster. SMAS lift is a deeper plane dissection where maybe the swelling and the post-operative recovery is going to be a little longer, but SMAS lift is what is needed in the older age group. Each has its own indication.
So there's an interesting question.
Yes.
You probably covered it many a times. I've probably tried to explain it to people. I want it to come from your words. Why do you split F.F.S completely into two surgeries?
The whole idea behind why I split it into two surgeries is to reduce the operative time. The more the number of hours that you spend under anesthesia, the more is the recovery rate is slower, more the amount of bruising and the pain. Always better to split it into two halves. You finish top half of the face, you get little more time to recover. Then maybe a week or so later you do the second half. It gives me as a surgeon more idea of how the upper half is going to look and maybe a little more flexibility on when I work on the lower face about what we can do to change the lower face to match the upper half.
Rather than being restricted by time within a certain, because these surgeries can get long. I've heard of 10-hour surgeries, which is a ridiculous amount of time under anesthesia. When it's cosmetic. If it's an operating life-saving procedure, then the risks outweigh the...
It's safer when you split it into two, it's safer.
And I've seen the patients come back even myself, is that the swelling just goes down so quick.
But what did you think about our pain management? Did you have any pain at all?
I don't know. I've read people say that FFS is very painful and it's traumatic and it's this and that. I haven't seen it yet. I haven't seen a painful FFS. You told me that when we cut through the nerves, the face is numb. There's no feeling on the top of the head. It's the same inside the mouth. There's no feeling from the lip or anything. It's like, it's very numb and very, if you're doing the facelift, it's very numb around the ears area. I had the facelift again the other week. No.
See, the amount of pain that you have is directly proportional to the amount of bone work that you have. It's mainly the bone shave and the bone contouring which is the painful part. What now we have is a very, very individualized pain management protocol, where along with IV painkillers, we also use some transdermal patches of painkillers. So they release a painkiller medication into your body for 5 days. So by the time those 5 days are over, the majorly painful part in your recovery is already over.
Laser resurfacing, why is it needed and can it be fitted in with the FFS?
Yeah, it can be fitted in. Laser resurfacing, the indication are to make the skin look glowy and polished. So somebody having sunburn or freckles, they can do well with the laser polishing. Normally, either you can do it maybe 3-4 days after you do the first stage, so that between the first and the second stage of FFS, you can get adequate time to recover from the laser resurfacing.
Yeah, because you wouldn't want the laser resurfacing done and then having to have the chin strap.
Yeah.
Because the chin strap is, it's a nightmare. But we've got to get through it. There's no pain without it, you know. Right, so it can be fitted in, and there is a very, very tight window between the first part, the upper part, and then we wait a few days, laser resurfacing, and then we go for that one. Is it dependent on how much surgery that the patient's had?
Yeah.
If you've had top and bottom blepharoplasty and a lot going on, and there's lots of swelling and lots of bruising.
Yeah, you can do it. You can do it maybe 7 days or 10 days after the first one.
So we could do it, but we couldn't do it after the jaw surgery.
We can, but then we can do it maybe 10 days after the jaw surgery.
Will it interfere with the strap?
No, it won't.
So we put some Degaterm or something on.
You can still wear the strap, no problem.
So unfortunately, this is the end of our part 2. Look forward to joining us again with Dr. Telang in part 3. Stay tuned.